I go to Missouri State University in Springfield, Missouri, and I am in the nursing program at Missouri State. It's a 4 years Bachelor's of Science in Nursing program. Well, it actually took a lot of preparation. I asked a lot of nurses that I work with. I asked instructors that I knew, and I just asked what their opinion was on that. And they said if you are looking to pursue a degree after your associates, such as your bachelor's and then on to master's, the best thing to do is just to get it all over with in just one big swipe. So I thought I would just go ahead and get my 4-year done within my bachelor's done within 4 years. And then after that, I can go on to get my master's or whatever. The Missouri State program is just a great program. It's known statewide, I feel like. I asked a lot of people about Missouri State's program. A lot of people say, I worked at a hospital here locally in Springfield, Missouri, and a lot of people there say that they love to hire Missouri State nursing students out of school, because they feel like we are well-rounded. We're taught about the whole patient, not just the physical part of the patient, but emotionally too, and spiritually, and all aspects of the patient. So that was a huge indicator that I wanted to go to Missouri State, but also because I checked their stats on how well their students do on passing the NCLEX RN exam, and it's like I think over 95%. So that was a huge indicator telling me that they obviously have successful students. So with that and a good reputation, I mean, it was hard to not go there. One thing that's different about Missouri State program is it's community-based as opposed to clinically based. So I was kind of looking at that, weighing the pros and cons with that. So with other schools I saw, well, they have more clinical experience as opposed to Missouri State, who has more community experience. So that was one thing I looked at, was clinical experience and things. I also looked at, like I said, the NCLEX RN exam pass rate for your state. I looked at how I talked to other students, and I looked at how well the instructors wanted them to succeed, because you hear about some places where the instructors are so hard on them that they get down on themselves. Well, I went somewhere that encouraged their students and uplifted them, and the instructor was someone that the students could turn to. I wanted a school that was a bachelor's program, just like I said earlier, so that I could get it all over with in one big chunk, so that if I wanted to go to grad school, I could do that faster. So yeah, several aspects go into it. What I love about Missouri State is they really start you out with theory first, and they work on your clinical and lab first, along with the theory, and then they let you move on to clinical when they think that you're ready. And every year it's the same, as in, you have a few weeks of theory and lab, and then you go into the clinical aspect. And I love that, because then you get to work with the patients and you're confident in your skills, and you have that basic knowledge behind what you're doing, so you feel confident in what you're doing because you understand it. So I really enjoy the way they do that. This year is a new pediatric clinical, and it was at Camp Barnabas. Camp Barnabas is in Monette, Missouri, and it's for special needs children. And throughout the whole summer, and we took 10 people for 1 week for, I think, 6 different weeks. And what we did is we did our pediatric clinical there, and we got to administer medications, do injections, all those kinds of things, that trach care, breathing treatments, all of those different things. And it was just a great place to learn, just enhance our knowledge and enhance our confidence, because they gave us a lot of independence there, and we got to learn a lot, and it was just a great opportunity. I think it's something special that not a lot of nursing schools do, but I mean, we stayed there on site for 6 nights and 7 days. So we really got to assess the client, determine what kind of treatment they needed, check with the RN that was above us, and then we actually got to treat them. So we gained a lot of confidence, a lot of independence, that kind of stuff. So that's another great opportunity that Missouri State University offers. One thing I would like to say is they do offer a student nurse organization at Missouri State University, and I'm the president of the student nurse organization, and I just I really love that they offer this organization at Missouri State for the nursing program because it really gets the students involved in the community locally for the nonprofit organizations. And we get to serve and volunteer. And so as a professional, that builds leadership skills, and that, again, shows what kind of community resources our patients have, so we can refer them to these places and things like that. So I think that is another great aspect of Missouri State's nursing program.